So we're going to go ahead and get started here. So not your mother's Botox, facial rejuvenation for the 21st century. So before we get started, I'm going to tell you guys about me real quick. Most of you probably know me, but I'm Jen, and I'm an APH and an RN at Biointegrative Health Center. And the last probably 9 months or so, I've been training and really diving into the aesthetic world. And there's so much we can do for our faces to really just make the skin look more youthful. I'm not into that plastic look or where people look at someone's face and they're like, oh, why did she do that? I definitely like that, the natural beauty, and that's really what we promote is beauty in a healthy way. So like holistic aesthetics. And so that's where the Botox versus Xeomin really comes in. So Botox and Xeomin are both a botulinum toxin, type A. They're neuromodulators. So basically what that means is that they paralyze the muscle and they stop the muscle from working. And so when we are talking about neuromodulators, Botox versus Xeomin, they're two different medications. They're very, very similar. We're going to go through the differences right now, but they both work the same way. And really what that does is they're freezing certain muscles that we use that give us the wrinkles and some of the sagging that we don't like that comes along with aging. And so the difference between Botox and Xeomin, Botox was created first and was on the market first. Botox is really what most people think of when they think about, anti-aging. That's one of the first things. Oh, Botox. Well, Botox is name brand. It's kind of like McDonald's versus Wendy's. And the ONA, botulism toxin A, and INCO, botulinum toxin A. And basically what that means is the way that Botox is made, they have an additive in there that is it's an inactive protein on the actual cell. So the problem with having additives in your product is that you can actually start to develop antibodies and develop some people, if you've heard of that, they can build a resistance to Botox. So after a while, you start building a tolerance. And so Xeomin, they've done study after study with Xeomin, and Xeomin is just as effective as Botox within 1%. It actually works a little quicker, and the best thing is there's no additives in there. So it's a more purified form. It is still a neurotoxin. So it still works the same way, and it still is just as effective. It lasts just as long. It's a little bit more cost effective. But it's manufactured in a way that it removes a lot of the impurities from the product. So we're not getting and triggering that immune response. And so, a lot of our patients too, we have to think about all of the IVs and the treatments and the health promotion we do. We're thinking support immune system, support. So why would we turn around and use a product that can, aggravate the immune system? And so that's where Xeomin is really the product that I lean the most heavily on. I love the product, and patients have great results with it. We do still have Botox available if that's something that you prefer to use. Okay, so what can we treat with Botox? So really one of the biggest things is to find a clinician who understands how the muscles in the face work. We have muscles that pull up and we have muscles that pull down. And depending on the strength of those muscles, that's where we're gonna see wrinkles in the forehead and wrinkles around the eyes and the frown lines and jowls. And we're going to go through all of that today, but it is really important to make sure that you are addressing the areas that bother you. So forehead lines, this is probably the most, the most common area that people look at and they're like, oh, they got Botox. Or the forehead lines really bother me, I need Botox. Forehead lines are kind of where where Botox got its name. They're pesky and they stick around. So this girl, you can see she's lifting her eyebrows, and you can see how deep those lines are in her forehead. And in the second picture, a week to 10 days later, all of these pictures will be a week to 10 days later for before and after. She's raising her eyebrows, so she's still making that facial expression, but she's not getting all that wrinkling. And so what happens is those creases that are permanent really start to soften. And for some people, if they're not that deep, they will actually go away. So here's another example of the forehead lines before and after. And so you can see the picture on the right-hand side. She does still have a few little creases in there, but it's really softened it's softened those creases that kind of were hanging out for her. And this guy is a good example. You can still see some of his creases on the right-hand side, but it's much softer. It's a much softer look than he had before. And oh, the furrow lines. So everyone knows these when our mother was scolding us. And this is the one, the forehead and the furrow lines are the two most common areas that I see patients, men and women, coming in to have treated. And I'm so excited about actually the rest of this lecture to teach you everything else that Botox or Xeomin can do for you, because there's just so many things that we can correct, which I love. So this is the furrow line. So if you look at the picture on the left, our before picture, you can see, right in between the eyebrows, you see that really dark or deep crease there. And that's really what we're going after. A lot of times, especially if we make that face a lot, or even if those muscles, I don't make that face a lot, but I can see little wrinkles kind of starting there. And that's just because those muscles on my face are really strong. And so it's also really common for us to have a stronger side. So more wrinkles on one side versus another. And that stuff, balancing out the face and giving you that really symmetrical look, is also something that's very easy to do. But you can see on the right-hand side, when he's trying to make that scowl, he's not able to furrow his brows together. So it really softens that. Same thing here. And a lot of people do start the Xeomin treatments early to really prevent forming those deep creases that we see on our parents. The brow lift. So this one's kind of fun. I think this one is a little more common. Some people are aware of this, but as we age, the biggest things that happen to our face is that so we lose fat and our face falls forward and down. And so we all know that. And there's so much focus on anti-aging with the eyes and the forehead, and we forget about the rest of the face. But our brows are one big thing that starts to fall on us. Usually, I think it's age 32 or 34. There are studies that show the brows are really starting to droop. And so even a lot of women by age 40, 50, they're even considering having that eyelid surgery to have that completely removed. And you can really start to prevent some of that by doing the brow lift. So the brow lift, it's very subtle, but if you can look at the picture on the left and look at how much eyelid she has, and look at the picture to the right, and you can see it's not a fake look. It gives her a more awake look. It lifts those skin folds off of her upper lid, and it really just gives her a brighter, more youthful eye. And that really, honestly, with this patient, that looks like the only Botox she had done, or Xeomin that she had done. So this patient, same way. You can see that her after photo, this gave her a nice lift. It actually rounds out her face much nicer. It lets her look more youthful, more awake, and gives her more eyelid to work with, especially for women who like to do makeup. It gives them a little more room for makeup. This is another young patient. Again, they're not drastic, but it's a really nice look that was able to give her a nice lift here. And our crow's feet. Don't we love these? I love crow's feet, actually. I think crow's feet, I love it. I love seeing them on people because it means you smile a lot. But it also does show our age. And so there's lots of ways to treat crow's feet. Um, I love this picture here. So we can actually see the crow's feet, her before and after. But one thing I want you to look at too is underneath her eye. And so not all of the practitioners do this, but this is something that if you were going to be changing the aesthetics of someone's face, I think it's really important to kind of look at the whole thing and what's happening as we start to correct. Sometimes when you make one correction, you can create another problem. And so here, when you see her smiling, you see her crow's feet, and you can actually see under her eye, some of the under eye skin is creasing there. And that's actually very normal. Most women by age 40 have that, and men have that by age 40. That's a really normal thing we see. But what we can do is when you hit, what you see happen is you'll see practitioners knock down the crow's feet, which is around the side of the eye. And then what happens is the under eye starts to really wrinkle a lot more. And so we can actually still treat that with Xeomin and put a little Xeomin on just the lower lid under the eye. And it's really just one unit on each eye. And it really softens the whole smile out. So when you see this before and after, this was really done nicely. It was they corrected the crow's feet and we corrected the under eye. So when she smiles now, she just looks so much younger. It took a lot of time off of her. And you can also look at her forehead wrinkles and the furrow lines right in between the eyebrows. You can see the creases on the left and kind of what's happening with her face just because of her normal movements. And then on the right hand side, you can see how it looks like her furrow lines are totally resolved and the forehead lines almost completely resolved, just much, much softer. And this has taken years off of her face. And, you can Botox or Xeomin, they both last about 3 months is what we tell everyone. Some people can, get a little more time out of it. But it's something you can come in every 3 months and you can stay much more youthful. And it is preventative. So here's another one we did. So we treated her crow's feet and we treated her under eyes. So you can see how much softer her under eye is looking when we've got the before and after. She's also had her whole forehead and the furrow lines treated as well. But I love the look when you include the under eye. So here's a picture where they did not. So you see the crow's feet corrected. So she's smiling in both pictures. And you can see on the right hand side, her crow's feet is gone, but there's still a lot of wrinkle under her eye. And that actually, I think, does create more wrinkles over time under the eye faster if you're not treating that in addition to the crow's feet. And not everybody likes it. It's not for everyone. I absolutely love it. Oh, and I love this one too, because, a lot of men don't realize that, they think, oh, it's, beauty stuff's just for women. Well, it's not. Men, we can change their face so much and make such a big difference and still keep you looking very masculine, but just taking some years off, which is lovely. And so you see here, this gentleman's crow's feet, they're just softer on his after picture, just softens those creases. It's still there. Bunny lines. So I personally think bunny lines are adorable. I don't know why. I just think they're cute. Bunny lines are when some people smile, they get that little wrinkle in their nose, kind of like a bunny nose. So usually when we're treating bunny lines, it's for people who, when they laugh or when their face moves a lot, that the nose wrinkles. And so what happens is you start seeing creases and wrinkles around the bridge of your nose, and it really shows your age. And you can see this even on younger people who just have those bunny lines naturally, and it really just ages their face a little bit. And so, treating the bunny lines. It just can soften the nose, so when you're laughing and scrunching up your nose, even you can't make those lines anymore. Um, so some people really like the difference. So this one, she was really cute. She, when she would smile a lot, she had just those permanent bunny lines, and she hated it. And look how it's just so soft afterwards. I love the difference it made for her. Okay, so now the lower part of the face. This is the part that so many people don't think about when they say, "Oh, I'm looking old." And they're looking at their forehead, their frown lines, and the wrinkles around their eyes. And then what a lot of people don't realize is that the lower part of our face will tell just as much how old we are as the upper part of our face. And I've also seen, I have a 50-year-old patient. uh, she just turned 50 and she's got no wrinkles on her face at all. But you still can see the downward tug and the jowls coming in. And so this is what we're going to look at now, because correcting the jowls can take more than a couple of years off. It can take, I don't know, 5 to 10 years easily off of a face. And so the jowls are, those lines on the sides of our chin. We have muscles there that really pull down. And so we've got gravity working against us. We lose fat of the fat pockets on our face as we age. And then we have those muscles that give us that downward tug. And so just treating with a little bit of Botox in the jowl area, like look at the difference in the before and after. I think this took 10 years off of her face. I think that looks absolutely amazing. Here's another really good example. It's a straight on example. And, it doesn't necessarily make them go away, but when it makes it look softer and it gives you just that more youthful look, I think it can make a really big difference. So yeah, you can see here just how much of a downward tug she had. And you can see even in the shadow how much of a pull she had on her face. So this was a good before and after for the jowl treatment, because you don't realize that. I think a lot of people don't realize what's happening there, or they do, but they don't realize how much that is aging them. So the other part of these downward muscles you're gonna see the downturned lip. And so that's where, when you look at a 20-year-old with just a straight face, no smile, just kind of stone face, the corners of their mouth are either going to go straight out or they curl up a little bit in like a little bit of a smile. And over time, because of the way our faces age, those muscles start to really tug the outside of our mouth. And we start to get, when we sit with a straight face, you start to see almost a frowny face. And you'll see the downturned corners of the lip. And so that's another great area that we can really treat. And so you can see here the pictures on the left. This is all the same woman. The two pictures on the left were her downward turned mouth. She's got a very pretty mouth, but it actually gives her some years. And when you're able to take away that downward tug, you can see on the right, it's such a subtle thing. There's no changes in the movement of your face. So like when we do the forehead lines and people are moving their face or making big gestures, you can see that their eyebrows raise, but their forehead doesn't wrinkle. And you can say, oh, they got some Botox. The cool thing about treating the jowls or the downturned lips or anything on the neck, or the chin, any of the stuff we're about to talk about, you can't even tell there was Botox done. Even a trained eye isn't going to know unless they see the face change over time as it wears off, or Xeomin done. And so, but just having that little bit of an upturn to the mouth gives someone's face such a more youthful look. Here's another good example. So we were able to take the downward turn and just kind of level that off for her. And it really makes a big difference. Oh, I love this one too. So in this one, so see, we weren't able to completely correct that with this patient in particular, to completely correct the downward turn, we would have to look at something more invasive like fillers or threading. And we're going to hit that in future webinars. But this can show you that even if we can't completely fix the problem, just how much softer we can make that. And doesn't she look so much more youthful? On the right, having just had those lines soften for her, I think looks a lot better. So the lip flip. We all love lips. And I have talked to so many patients who want that pouty look, but are maybe afraid of fillers or not quite ready to go there yet. There's actually stuff we can do for your lips. And that is, we are able to inject around the mouth, and it really gives your lips more of a pout. It softens those muscles enough to relax, to allow the lips really to release. There's no filler in here. This is totally this girl's lips before and after a Xeomin treatment. And what's really nice too is, as ladies age, we get those smooch lines, or some people call them smoker's mouth. I don't know how many people really still smoke, but we still get those wrinkles around our upper lip. And the lip flip can knock down those wrinkles, soften those wrinkles, in addition to giving you a more youthful pout. And I really like this one. So you can see the above picture and below. And it really just, it's such a subtle thing, but it gives you such a more youthful look. Really pretty lips. Gummy Smile. So this is one, I was in the aesthetic world for a little while before I realized we could even treat this, and that it wasn't aesthetically pleasing. There's a lot about ratios and proportions, and everything we do as we're treating a face and looking at a face, we want to make sure we match your face symmetrically on both sides, and what's ethnically appropriate to your face. But a gummy smile is one that actually is a little less appealing to the eye. And so with just a tiny bit of Xeomin, we're able to inject a certain point, and it's able to make that big, huge smile still big and huge, but it covers the gum line. And I love this because it gives those who have that gummy smile so much more confidence to keep smiling. And man, with the world having been in masks for the last year, we need more smiles. So here's another great one. And she is second hers wears off, she is back in getting more Xeomin to knock down that gummy smile. But look how pretty that smile is. It's still her face. It's still a beautiful smile. It just covers up that gum line a little bit. So the chin. This one I see, I love this one on older men, older anybody, but it's so crazy how early you can start to see a little bit of dimpling in the chin. Dimpling in the chin, and I didn't know this until I was in the aesthetic world, it's one of those clues, just like the jowls or the downturned mouth, that you don't hone in on. You don't say, ooh, their corners of their mouth are turning down, but you could look at their face and say, oh, they're 65, easy. And these are some of the things that really age us, that you can take care of and soften so easily. And so one of those is dimpling of the chin. Some people have a really strong dimpling of the chin naturally. We'll look at one of those pictures in a minute. And it can soften that, but it also softens the dimpling over time, or completely smooths out the chin. And so this is one, he had a really strong natural dimple, and it was really able to soften that for him, and just give him much more confidence. And this is a young girl who was just getting a lot of dimpling in her chin, and the Botox and Xeomin were able to soften that for her. So that's definitely, there's just so many cool little tricks we can do to take years off your face that people don't realize are adding years to their face. And the masseter muscles. So these guys are, um, women like to have that upside down V shape of their face. So that in the aesthetic world, the most visually pleasing faces are going to be a little more longer and angular. And so women in particular don't like a really strong jawline. And so when we start treating this, we're able to inject that masseter muscle that's overused and overgrown, and by not using the muscle and treating it with Xeomin, it actually shrinks down. And look at the difference in this young girl's face. And this is such an easy fix. Um, to put this in there. A lot of times people will get, with really strong masseter muscles, they can clench their teeth or grind their teeth at night. You'll see that a lot. And so we will inject those muscles actually for that as well. That's usually why you're getting some of those overdeveloped masseter muscles. But even on men who need that really square jaw with the overdeveloped masseter muscle, if you look at, his jawline on the left and his jawline on the right, it changed his whole face, just by really, just like the girl, it can just knock that down. So when we think about, Xeomin, and the neuromodulators, we're thinking shrinking. We're shrinking those muscles, we're tightening things up and softening lines. Which brings us to the neck lift. And I love the neck lift. There is actually 3 different ways to do a neck lift with Xeomin and Botox. And so one, we can treat the neck rings. So if you can look at her face, actually, on this patient, she had all 3, but we soften the neck rings. And so we're able to inject down the neck and really soften all of that pull. We're able to, if you look right underneath her chin, we're able to tighten that skin up a little bit. And then we're able to do what's called a Nefertiti neck lift. And that gives you a little bit more of a defined chin line. Nefertiti was an Egyptian goddess who apparently had a very nice neck and angular jawline that was very attractive. And so that's where the name came from. A lot of us refer to some of this as a 3-minute neck lift. It's actually all of these treatments are very, very quick. You're in and out of the office with me in 20-30 minutes tops. And within a couple of days, your face and your neck can look completely younger. We can take a lot of years off. So this is another Nefertiti neck lift with the 3-minute neck lift underneath. But so you can see how it actually pulled back her jowls, because of the neck lift, the mechanism, it actually tightens because it pulls back and pulls out that structure of the jawline. It tightened up the skin underneath of her chin and really softened out those wrinkles. This was not a neck lift, guys. This was Xeomin. And here's another, this one kind of same deal. She had the whole works done. It was the Nefertiti neck lift, the jowls that we treated, and then the whole neck, like underneath her chin and and all of the rings on her neck to soften up. And it took a lot of time off. It gave her some years back for sure. And she still looks like her, and her face moves the same. She chews the same. Everything feels the same. And here's another nice picture. So you can see the jowls are more tight, and underneath the skin, underneath the chin, the skin is much tighter. So there's so many beautiful things we can do. So Xeomin just like Botox, is also not just for aesthetics. So we're not going to spend a ton of time, but I did want to talk about a couple of things we can treat that are outside of the aesthetic world. And one huge one is tension headaches. Headaches, especially if you've been plagued with constant tension headaches, can really be debilitating and affect your quality of life. And so there's many insertion points. So this is a diagram of everywhere we would insert insert the Xeomin. So all of these different points is where you would get an injection. But some people, yes, the Xeomin is worn off in 3, maybe 4 months, but because they've had that tension in those muscles released, what we're seeing is that patients aren't needing this as soon as it wears off the way that they like it aesthetically. They're needing these injections kind of 1 to 2 times a year, but it's able to relax those muscles down so much and really calm them down. And so, man, this can make a huge difference in treating headaches. So that's one thing to think about. And some insurances do cover that. So that would be something we could super bill you for, to have you submit. And one of the other really cool treatments is for TMJ. TMJ, if you have ever suffered from TMJ, you know how horribly painful that can be, and can also give you headaches. So depending on how severe the TMJ is, we can do 1 to 2 to 5 injection sites. And that was just kind of depends on what's clicking and what's happening. And we usually do it equally on each side, whatever we're injecting with, just to kind of keep that symmetry and balance that out. But even the TMJ headaches can drop at least by 50% by 1 to 2 injections, not even all 5. So those are some fun things. So to recap, these are all of the fun things we can do with Xeomin. We can do the forehead lines, the frown lines, the eyebrow lift, the crow's feet, our bunny lines. We can treat the lines, the little lip lines around the mouth. We can give your lips, do that lip flip, and give you more of a pout. We can take up the corners of your mouth. We can treat your gummy smile, those masseter muscles, and the TMJ relief. We can actually contour that jawline a little bit. I don't know if I said dimpled chin, and the neck. We can do the 3-minute neck lift. So, and these are approximate units. It kind of depends how much we're going to use depending on how strong those muscles are. Some people with really strong lines in the glabellar, they're going to get the full 20 to 25 units, where if those muscles aren't as strong for you, those frown lines, maybe you would just get 10 units. And we can always add more. We can always start light and see what you think and how you like it and add more. So that is the end of our lecture. I'm going to stop our screen share. If you have any questions, please pop them into the Q&A now. But I absolutely love, I love the products that we're using, and really the Xeomin being able to treat faces cosmetically and give you such a softer look to the fine lines that you have, and taking away years makes it really, I don't know, it makes it really fun. Hi, Carrie. Thank you. I can't wait to treat you. When are you guys coming next? I hope to see you soon. But yes, it's amazing how much we can do, and I've been having so much fun. Good. I'm glad you're coming in soon. So get on my books, because we can, and really what I love that we're able to go through this, because you can look in the mirror and before you guys come see me and really kind of take a look and say, okay, these are the problems that are bothering me. And we can just go to town and really take care of anything that that you guys aren't happy with. So how many areas are you able to treat at one time? So that's a great question. Actually, there really isn't much. There really isn't much of a max on the Xeomin or Botox. Actually, the max amount we've ever put in is around 600, and that's treating the migraines. Because so you're putting in concentrated amounts all over the head and the back and the traps. So those, we're never getting to that on a face. I think we could treat all of the areas that we even talked about today if that's what you really wanted. It'll cost you, but it can definitely happen in one sitting. How long have you been doing this? Hi, Laura. I started last year, so I've been doing this for just a little under a year now. But I absolutely love it. I'm passionate about it, and I think it's so much fun to be working on women and making them feel better about how they look. And um, okay, what's our next question? And building that self-confidence. That makes me really happy to do. I enjoy it. Are you familiar with Daxi by Reverence, which is supposed to be approved soon if it's not already? Supposedly lasts 6 months versus 3. So I believe that's still in trial, but we are all kind of waiting to see what's going to happen. But I don't believe that it's out yet. And then my question too with this one would be, before I'm going to pull that in as a main product I'll stand behind, I'm going to want to see if there's any immune response to the product, because that's kind of a big thing. We don't want to be triggering a big immune response, which is why I'm so supportive of the Xeomin product over Botox. But that's a great question and something I'm happy to look into for you. And yes, anything that would last 6 months would be way better than 3. And for some people, the Xeomin and the Botox does last 6 months. It doesn't happen for everyone. It's different based on your metabolism and what you have going on. So I have another question here. Did I understand this correctly? Are you saying that treatments can help stop the nighttime teeth grinding? They can. They can help at least alleviate some of it. If not, grinding is a little different. The clenching, for sure, it can help, but it does alleviate some of that teeth grinding. I did that recently on a patient, and her grinding was giving her terrible headaches. She said, and we weren't really aggressive with it. She's really young, and I used Botox on her, and I didn't want to really overstimulate her immune system with everything she had going on. And she said the little bit we did dropped her headaches by 50%, which is wonderful. So I see, oh yeah, we are recording this and we can share it with her. We have a YouTube channel, BIHCI does, and Biointegrative Health Center. King, if you could type in what our YouTube channel is, or something possibly for the patients. So yes, she can hop on, and anyone can rewatch this video. All of the videos and webinars we're doing are going up on our YouTube page. So that's a great question. Is Xeomin less expensive than Botox? Yes, it is. It's not significantly expensive or less expensive, but Botox, the typical charge is $12 per unit on the face. Xeomin is 10. And so, I mean, if you add that up over 60 units, it's a nice savings. And the great thing that I love about Xeomin is came on the market a few years ago, and they were showing a few studies showing that it was less effective than Botox. And so what happened was they went back kind of to the drawing board to say, hey, what's going on here? And what they found was it was actually just how the medicine was being reconstituted by the practitioner. And they have us now, they have us invert it differently. And they were showing there was active medication on the rubber top of our vial. And so we just set the vial upside down for a couple minutes to make sure all of the medications dissolved into the solution. And so Xeomin is coming back out. Gwyneth Paltrow's behind it because, she's all holistic beauty guru, and you know, and her really standing behind the product. What Xeomin is doing now is they're offering points. So if you start becoming a regular Xeomin client, you pay the $10 a unit, but then you start getting coupon codes if you get so many units, and they actually send you a Visa. I believe it's a Visa gift card. They give you cash back for using their product because they stand behind it so much. And so there's a lot of really fun and cool incentives going on. I don't have a date yet. I'm working on that, but I do want to have a Xeomin party at the clinic if you guys are interested. So it could be, you know, bringing friends and coming together and hopefully getting some of those good discount coupon codes for cash back, because we all love to save money. So yes, and it is awesome to have another product that is not Botox. I think I agree with you, and it makes me feel a lot safer too, because anytime we start doing you know, things that activate and aggravate our immune system really can you know, start other things going awry. So yeah, so if we don't have any other questions, you guys, I would like to thank you all for joining me. I really appreciate you being here tonight. I'm going to start our poll, so give us feedback on anything you'd like to be hearing. And thank you guys for joining us or joining me today. This was fun. I love this stuff. I do have another webinar coming up on Tuesday, and Tuesday's webinar is going to be about our fillers. It's insane what we can do with Xeomin on the face. It's even more crazy what we can do with fillers, and just changing really the way that a face looks. It's so much fun what we can do these days. So I hope you guys join me on Tuesday. Hope you liked and enjoyed our content tonight. So I'm launching our poll, and thank you for taking the time. Aw, thanks, Carrie. I can't wait to see you. And thanks, everyone. I really, really appreciate you being here tonight. It's fun. If you guys come in too, Lucy will show you. I've given Lucy and Carrie both Botox, and they show off their faces all day long. And Lucy will always show you how I gave her the brow lift, and she just loves it. Oh, and our link for our YouTube channel is in the chat box if any of you guys want to copy and paste that. And I think it takes maybe just a few days for our webinar to get posted, but just in case you guys, if anyone missed it, you can definitely share that link. So thank you. And thank you guys for putting out the poll or filling out the poll. It really helps us kind of nail down what content we're doing. Yay. This is great. All right, everyone. Thank you so much. And I hope you have a wonderful weekend. And I hope to see you all soon.